organ in your body. Now, people would think that the gut is just this tube where you absorb nutrients through. But if the gut is not working properly, you can have issues with your brain, with your heart, and it will impact how long you'll live. In today's dietary rules, lots of folks are eating genetically modified foods, processed foods. We are more stressed now than ever. A lot of stress-related condition, and it all affects the gut. But the gut has about 70%, come on in, Pastor, 70% of the immune system that lines the gut. And I'm going to teach you some anatomy today, so bear with me, because I think it's important to understand anatomy when you think of the gut and the function. And structure defines function. So I'm going to go through the anatomy of the gut, why it's important, the different role that the gut play, not only in digestion and absorption of nutrients, but in your immune system. Does anybody here know anybody with an autoimmune disease? Is anybody? Yeah, you know some. An autoimmune disease. You ever heard of lupus? Systemic lupus, that's one. Rheumatoid arthritis, that's two. Thyroiditis, inflammation. Crohn's disease, ulcerative colitis, ankylosing spondylitis. Has anybody ever heard of some of those diseases? Yes. Those are all autoimmune diseases. And allergies. Does anybody here have allergies? To food, to pollen, to dust, to mold. All of this is mediated through the gut. Okay? So I'm talking about a very important organ. There's 2 seats right there for you guys. Yeah. And I want you to know that, you are what you eat, and you have to nourish your body properly. The triad to good nutrition is going to be good nutrition, adequate amount of activity, exercise, and managing your stress or spirituality. If you have those 3 things together, you're going to live a long and productive life. Okay? So let's start. The gut is so important. It helps to break down food. It's for energy, for waste elimination, for water balance. I mentioned it's for your immune system, immune defense. But did you know it has hormones in the gut? There's a lot of hormones that regulate our well-being. It regulates your hunger. It regulates your mood and your behavior. It also regulates your metabolism, the rate of how you burn calories. Lots of drugs are now targeted. Come on in. There's another seat here. You want to give up that seat right there. So the pharmaceutical industry, our friends, have made a lot of drugs that impact the hormones in the gut. I'm sure you guys have heard of proton pump inhibitors, Nexium, Prilosec, you've heard of those. But some of the diabetes drugs are also made based on this as well. Welcome. Okay, so when the gut is sick, it's going to impact the entire body. It's not just the gut. It's going to impact the entire body. It's going to impact how you feel. It's going to impact your day-to-day activity, your mood, and so on. So good nutrition is important, and it's an essential part of giving yourself good gut health. Little anatomy. This is a bolus of food, nice colorful particle of food here. This is the esophagus. You swallow it, it goes to this food pipe, that's another name. Then it goes into the stomach. Through the stomach, it goes into the small intestines. But you have these other organs that impact the gut. The gallbladder pushes out bile to break down the fats in your food. The pancreas right here puts out digestive enzymes to break down the food. But if you look at it, it's really a tube, because it goes here, then it goes to about 20 feet of small intestines, which is where 90% of the absorption of nutrients. Could somebody tell me what a nutrient is? We have 3 major nutrients that we get. Does anybody know when you eat food, there's 3 types? Carbohydrates, protein, fats. All right. You've been a member for a long time. I'm kidding, that's an easy question. Now, you have the large intestine, and that's where primarily most of the water gets reabsorbed. Okay? And you have a lot of bacteria. I'm going to talk about how important bacteria is, good bacteria, for the gut and your immune system. So the gut breaks down, let's say you eat a piece of toast, wheat bread. It's going to break it down, that's a big carbohydrate, it's going to break it down into the smallest component. What's the smallest component of a carbohydrate? Does anybody know? Sugar, right? It's glucose. It's a monosaccharide. So every carbohydrate eventually turns into what? Sugar. Everything, right? What the difference is, you have complex carbohydrates like vegetables and some fruits that breaks down slower. Okay, so the body has to actually work to break it down. So the net effect is that you don't gain any calories. So that's why vegetables are so good for you. And the fiber in the vegetables slows down the absorption of the carbohydrates once it gets broken down. So carbohydrates break down into glucose or sugar, right? Sucrose, which is 2 glucose molecules. And then what about fats? What does fats break down into? Does anybody know? When you eat fat, say you eat a hamburger. What's in a hamburger? You have protein and you have fat, right? When fat breaks down, what does it break down into? What's the smallest object of a fat? I'm going to teach today then. It's called a fatty acid. It's a smaller breakdown. It's a fatty acid. Okay, so that's the smallest break. Well, fatty acids can be absorbed through the gut, but a big fat globule that you just eat from a little piece of steak is not going to just go and get absorbed. It shouldn't, not if you have good gut integrity. So the body has to break it down into its smallest component, then it gets absorbed across the membrane into the blood. Actually, before it goes in the blood, passes through the liver, and the liver then packages it so it can be excreted in the blood for utilization. Okay, last one, proteins. What's a protein? Name me a protein. I'm looking at you. Fish, that's protein. Muscle is protein, right? So animal meat is protein, but you can get protein from what else? From nuts. And what else? Grains. Yeah. So when you do those, you're looking at somewhere about 30 to 40% protein that are in plant-based stuff. But if you want like more protein, that's more meat-based or fish-based or animal-based products. So when you break down protein, okay, what is the smallest unit of a protein? Does anybody know that for it to get absorbed into the body? I know, doctor. We have some doctors and nurses here, so I don't want them to answer. Hi. It's called an amino acid. Okay, so let's go through that again. Carbohydrates break down into sugar, fats break down into fatty acids, and protein breaks down into amino acids, right? And that's what if we did that, we broke down all our stuff and we were able to get it across, we wouldn't have any problems. The problem comes in when our gut is not working properly, so then bigger globules go across the membrane. The immune system thinks that this is foreign, because what is this thing coming across? And that's the whole basis of allergies and autoimmune disease, because your immune system gets deregulated, and then it produces antibodies, and you start attacking things that you shouldn't attack, like your thyroid or your kidneys or your lungs, and that's how people get lupus and thyroiditis and stuff like that. So it's so important for us to be digesting our food very, very well into the smallest component, so you don't trigger these reactions. Okay? Okay, so I said a lot of it without actually, these are the slides that basically explain it. So the gastrointestinal tract is this big long tube. the lining of the tube is very important. You got to keep the lining of the tube with good integrity. They're like soldiers because the lining is in contact with the external world. If you look at your mouth going down your food pipe, it's like this tube that's related to the outside. So the cells that line the tube, they have to be juxtaposed. They have to be right next to each other, tightly bounded, so that bigger particles and bacteria and fungi and yeast don't go into the bloodstream. So they're like your soldiers, and I'm going to show you that. So the salivary gland is in the mouth. The liver, pancreas, and gallbladder, they have important digestive function, and the food is then propelled along the length through muscle contraction. This is what it looks like. Again, the oral cavity, you have your glands that produces amylase, the salivary gland that produces some digestive enzyme that break down food, so digestion actually starts in the mouth. Food goes down here, goes to the stomach, then once again through the small intestines, large intestines, and then you have the gallbladder putting out the bile. It's all attached. They're just kind of, they're attached to this long tube. And look at it as that way and why it's important. Now, the cells that line the stomach, this is the inside of the gut. You have many different cells. It's not just this tube. They're very multifunctional. They produce mucus to protect the lining of the gut. They produce bicarbonate to neutralize the acid. They produce acid. They produce B12. Without the adequate cells here, you won't be able to produce your B12. I'm not going to get into the names of the cells, but I just want you to know that the lining, those cells that line the gut, have very important function for overall gut health. Acid production and so on and so forth. Okay, so the purpose of the GI tract is to break down the nutrients which can be absorbed into the body to provide energy. So first you take it in your mouth. Second, it goes through the small intestine where protein, fats, and carbohydrates are broken down into the smaller particles that I talked about. And then the large intestine plays a role in absorbing the water. Finally, we then excrete the waste product. So, like I said, it's a muscular tube. And all of it has specialized function. The esophagus has a different function. I want to spend a little bit of time on this slide. Because if you take that hose and you cut that hose in a cross section, this is what you see in the GI tract. And I want you to understand it, because when I get into detoxification, you have to understand how important it is to make sure that the integrity of this particular tube is intact. You have the outside layer, then you have this pink part here is a muscle. And that's what constricts, and it pushes the food down. Then you have this area here where you have most of your blood vessels, and then you have the lining. This is the inside of the lumen. And then you have the way the cells are curved up and protruding inside the lumen, it gives it more surface area so you can absorb more of your nutrients. That's the way God designed it. Only God could do this. And I'm sure if you've ever seen some of the animals, like a cow, and you look at the inside of their intestine, you notice they got a lot of folds. Those folds have a purpose. Those folds are so you can increase your absorptive lining and you could absorb your nutrients. This is what causes a lot of disease. We call it leaky gut. Remember I told you have these soldiers and they're tightly next to each other. These are the cells that line the gut, okay? They're supposed to be very, very tight. No space should be between them. When there's space, when inflammation comes about from stress or bad food or from an infection, these things open up and then bad particles go into your bloodstream. When bad particles go into your bloodstream, you get sick. So we call this leaky gut syndrome. This is the main reason why you need detoxification, because you got to heal the gut, okay? And over time, I recommend detoxifying yourself at least twice a year. If you have an autoimmune disease, you need to do it at least every 2 to 3 months, because it's so important to heal the gut. You want to heal those cells. All right, so what happens is that this inflammation that occurs in the gut, which is a mixture of white blood cells coming into the gut and making it weaken the immune system, then you're going to basically get all these bad things going inside and creating havoc for you. This is a good picture of it. These are bigger food particles here, and these are tiny nutrients. When the gut is working properly, only the tiny nutrients, notice how tight these cells are between each other? Only the tiny nutrients get through. So this is a sign of a healthy gut. This is a sign of a gut that has leaky. You notice the cells are opened up between, so you have an opportunity for these bigger particles to seep in and go into your gut. This is a problem. So we have to fix this. Most people with acne, inflammatory bowel, high blood pressure, obesity, have leaky gut. Once again, look at it this way. This is how a normal healthy lining looks after you get inflammation in the gut from stress, again, because most of us are stressed, and bad food. You get a damaged lining, you get leaky gut, you see all these toxins that are coming in, yeasts and funguses and all of that stuff, it goes into the bloodstream and it gets picked up and causes disease. I'm stressing that point. What causes this increased permeability, or the increase of the leaky gut? Crohn's disease, inflammatory bowel disease, irritable bowel can cause it as well. If you're taking a lot of Advil over the counter, does anybody take Advil every day, or naproxen, or not good? It's a prostaglandin inhibitor. Basically, it's going to create leaky gut if you're taking it every single day. Chronic stress. Anybody here have stress? Yeah. Chronic stress. And let me just talk a little bit about how the pathology of how stress. When you're stressed, the body is sensing that you're in a war, right? So your adrenaline levels go up. Your cortisol levels go up. Cortisol suppresses the immune system, so those soldiers can't work as strong anymore. So when people are stressed, they get cancer, they get obese, because then they're not digesting their food properly, and they get a lot of autoimmune disease. So try to manage your stress in a positive way, because you're going to have stress. It's how you receive it, how you manage that stress. Okay, so that's why we have our massage therapists over there, and we got to get monthly or weekly massages if you can afford it. Now, this thing here called dysbiosis. This is your bacterial flora. If you have a lot of bacteria in your gut, you're supposed to have a lot of bacteria, but you're not supposed to have a lot of bad bacteria. You're supposed to have a good balance. When you get stressed out, you have an overwhelming amount of bad bacteria. Toxins, including alcohol. They say caffeine, excessive amount of caffeine, tobacco, are bad toxins. Medications can cause you to have this leaky gut. And then obviously if you're exercising, which I exercise pretty routinely, and I recommend all my patients to get at least 30 minutes to an hour on most days. So that's, most days is between 5 and 6 days a week, not 2 and 3 as they used to recommend, but you're eating every day, so you should be exercising every day. But strenuous exercise, people who exercise too much, can lead to leaky gut, because it's the same process of inflammation that you're producing when you exercise too much. These are other things. When you get older, your gut doesn't work as well. Can you stop aging?
No.
Okay. Very little you can do about this one. The alternative is to die, so I think a lot of us would rather get old than to die, right? So aging though, when you get older, if you take care of yourself, your body will respond better, your immune system will work better. So there's things you can do to slow down the aging process. I have 80-year-olds that are doing extremely well. They do everything that they could do when they were 40. And then I have 80-year-olds that are in a nursing home that, or have tubes coming on from every orifice, and they've lost their memory, they have Alzheimer's or whatever. So it really depends on how you preserve your body, what nutrients you're putting in your body, how much activity you're giving your body, and how you're managing your stress. All a part of the anti-aging process. So yeah, there are things you can do, but you can't stop the number, but you can do it gracefully. Viral infections like AIDS, this is an antibody that's important for the gut. A lot of folks have a deficiency, they're just born with a deficiency of IgA. Food allergies, if you're allergic to foods, you can get increased permeability. If you've had chemotherapy or radiation therapy, it'll kill your gut. Endotoxins and trauma, if you've had emotional trauma or bacterial trauma, if your immune system is overloaded, and chronic infections, all of those lead to a leaky gut. Now I'm going to talk a little bit about bacteria, because I think most people think of bacteria as this bad thing, but without good bacteria in our gut, we won't be able to metabolize our food properly. And it's there to compete, the good bacteria is there to compete with bad bacteria. E. coli, Clostridium, those can be bad bacteria if they have overgrowth of those bacteria. So when you have enough lactobacilli and acidophilus and Saccharomyces, it's basically inhibiting the growth of those other bacteria. To keep everything in balance, then you're not going to get overgrowth of bad bacteria, which cause disease and fatigue, chronic fatigue especially. A lot of Americans have what we call dysbiosis. They have an overgrowth of bad bacteria and not good bacteria. They don't have the right balance of good bacteria. Women, it's affected more than men, because women tend to handle stress a little bit differently than men. So this is what bacteria does for you. It aids in digestion, it aids in absorption of your fatty acids, it aids in vitamin B production and vitamin K. Without it, you can't break this down and get absorbed. You need to be able to absorb these vitamins. It helps with bile acid metabolism, and it helps with your immune system. Toxins in everyday life. Lifestyle toxins. Anybody here on medication? I'm not on medication. I never want to be on medication, but I'm on nutrients, because that's the best medication, is your nutrients. But if you're sick, you need to be on medication, but you can change it at any point through lifestyle. And it's just a matter of time, getting your body, readjust your body so your body is healing itself and not just constantly being barraged with a whole bunch of drugs. But drugs basically it has to be detoxified by the liver. Sugar, and then processed food. Sugar is not good for you in a processed form. If it's in a complex form like vegetables and fruit, it's good, because then the absorption is slow. But we're lazy, so what we do is we take sugar cane and we process it, and then we create sugar. And then we put sugar in everything. What is in 1 can of Coca-Cola, soft drink? Well, how much teaspoons of sugar is in one 16-ounce can?
Is it 70?
70? No, not that much. 16. But if you were sweetening lemonade, right? 16 ounces of lemonade, you'd probably put how many spoons? 3 or 4 maybe, if you have a sweet tooth. They put so much in soda, and the phosphates hides the sugar, so you just drink it down. You just drank 16 teaspoons of sugar in a 16-ounce Coke. I tell people, just don't drink sugar, soda. Now the diet soda, is that better?
No.
Okay. She's like, yes. Well, I don't like anything artificial, so it's not better, and it's been linked with obesity. People who, they'll go into McDonald's, they'll get the Big Mac and the large fry, supersize that, and then they'll get a Diet Coke, and think that that's really going to help them. No, so it basically, when you put weight on, the fact that you're overweight makes you hungry. makes you want to eat more. So that's why fat people tend to get fatter, because the obese, the cells on your body, the adipose tissue, creates a craving, so it's on top of itself. And sugar is very addicting, more addicting than crack cocaine. And the studies have shown it. I'm not going to get into that topic, but it is. It's definitely more addicting than crack cocaine. There are people who eat chocolate and eat a lot of sugar, and you know, they just can't get off of it, and as much as they can when they're the cocaine addict. So, all right. So you have internal toxins as well. Now, when we eat, when you put gas in a car, what comes out of the exhaust? Fumes, right? Exhaust. When you eat, what comes out of us? Air. Air, yeah. But we're producing, when we absorb it, we're producing free radicals, right? We're producing free radicals. We're producing waste as well. So this builds up in your body, the metabolic reaction, because we have to, sugar will break down and it'll form energy, and so that when I'm able to move right now and I'm able to talk, because that's fuel. It's fuel for us. All the fuel particles are. So, but the byproducts of those fuel particles are free radicals. All right? So when you have free radicals, the body normally will contain those free radicals and prevent you from wrinkling, from aging, from developing heart disease if you have enough antioxidants. That's why taking fruits and vegetables is loaded with antioxidants, and vitamins are loaded with antioxidants. It quells that damage that the exhaust from our food and everyday metabolism would produce. Very important. That's why nutrients are crucial. It's very, very important. Glutathione is an excellent antioxidant. Coenzyme Q10, excellent antioxidant. Resveratrol, all good antioxidants to put out the fire once we've created it from our everyday metabolism. Okay? Most toxins are fat soluble. They dissolve in fat, and they enter the cells and the liver, and they're responsible for a lot of issues. Signs and symptoms. Help. This is what happens when you have leaky gut. You get bloating. Does anybody get bloated? You get abdominal pain and cramping. Sometimes we call this irritable bowel. You know, you're like, oh, sometimes you get a little diarrhea, and sometimes you get a little constipation, some cramping. That's not supposed to happen. Poor digestion. Does anybody have acid reflux? That's a sign. People who have acid reflux have increased intestinal permeability, they don't have the right bacteria, or they're overweight. Diarrhea, constipation, and dyspepsia, which is kind of the same thing as GERD. Inflammation. People with heart disease and autoimmune disease and cancer have intestinal permeability, leaky gut. People with acne and eczema have leaky gut. If you have slow in your mentation and your memory, feeling foggy, you may have leaky gut. If you have depression and chronic fatigue, you may have leaky gut. If you have chronic pain, you get up and you're just in pain, you wonder what it's all about. Oh, it's fibromyalgia. You have leaky gut. And if you heal your gut, a lot of these symptoms go away. Clinical conditions, these are what's associated with leaky gut. Acne, aging, alcoholism, allergic disorders, ankylosing spondylitis, I talked about this before, which is an inflammation of the spine, arthritis, inflammatory joint disease, asthma, autism, some research out there on that. Celiac disease, anybody heard of gluten? Gluten enteropathy or gluten sensitivity? Otherwise, sometimes they call that celiac disease, depending on the severity of it. Chemotherapy, if you've had chemotherapy. This is a big one. We have an epidemic of attention deficit and hyperactivity disorder. What are our kids eating now? 40% of our children are overweight or obese. They're eating a lot of sugar. They're eating a lot of processed foods. A lot of white bread, a lot of white flour, a lot of white everything, which is processed. They bleach it. So all the natural ingredients, the fibers and the vitamins have been removed. Epidemic of hyperactivity in children. Chronic fatigue. Who has chronic fatigue? Who's always tired? Very, very common. Very, very common. You heal your gut, you'll notice your energy will go through the roof. Okay? Cystic fibrosis. This is something, it's an inherited condition, but obviously it will create a problem with intestinal permeability as well. Eczema, big. Now, a lot of the kids, they're allergic to cow's milk, or they're allergic to cheese or to soy, and they'll get eczema from that. Food allergies, HIV, not good. And obviously, when you have that, your immune system is completely shut down. Hives, irritable bowel. This is inflammatory bowel, and this is irritable bowel. All sorts of intestinal infections like salmonella can cause the leaky gut, and malabsorption problems. So what do you have to do? This is the solution. Avril, what do you have to do? What are you doing now? Exercise. That's one thing, right? Exercise is important. What's most important is the diet. And I call it the elimination diet, because you have to eliminate sugar out of your diet, period. You just have to eat complex sugar. Eat the complex carbs. Don't eat processed sugar. That means flour. Flour and sugar is equal in their glycemic index. Equal. So you get that out of your body, you're going to be doing 100% better. I know a lot of women during a certain times of the month, they have to eat sugar. They like chocolate. That's processed, right? They like cakes, sweet cakes. They can't do without their desserts after dinner. You know, all of that, it just raises your insulin level. You hold on to fat and create a problem for you. You keep the sugar out of your diet, keep the flour out of your diet, you will notice a tremendous, people can't lose weight, they can't lose weight. What are you having at night? Oh, well, you know, I have a little ice cream every now and then. Every now and then. More now than then. No, they really have to get the diet. And other foods to eliminate are dairy. The cow's dairy milk is not good. If you're going to drink milk, we're by far, I want you guys to know, we're the only mammal that drink another mammal's milk. There's plenty of beans around for us to milk. So, you know, you can have rice milk, you can have almond milk, you can have a variety of other milk. So, you don't need cow's milk. The cow protein is not good for you, especially the way they shoot up these cows with hormones. You're getting all of that in there, and you don't need it. So the elimination diet. So dairy is important, sugar is important to get rid of, and then wheat. Wheat. Why do I say wheat? Why is wheat bad?
Because it's enriched.
Because it's what?
I mean, when they enrich the wheat as opposed to the whole grain.
Yeah, well, enrich means that they've bleached it and then put a few things back. That's what enrich means. But no, the wheat in this country is all, 99% of it is genetically modified. So you're getting a higher content of gluten, which is the protein that's in wheat. And it's sticky. It's very allergenic, and it creates a problem for your gut. So if you're trying to lose weight, you're trying to feel better, get rid of your chronic fatigue, stop eating wheat. That's the other thing on the diet. Exercise. Stress reduction, get your massage therapy, yoga is important, stretching is important, going to church, reading your Bible, having a good relationship with, you know, I'm a Christian, but it doesn't really, the research shows that as long as you have a spiritual part of you, you are going to do much better if you should get ill, and you get better support systems around you. Supplements. You got to take, since the food is so depleted of nutrients, you have to take supplements. It's either you take supplements or you take drugs. You know, you need vitamin D, right? You're going to eat fish every day? You can eat salmon every day and get enough vitamin D. But if you don't want to eat salmon every day, then you should take your vitamin D. You know, especially when they bleach everything. So, your supplements and your probiotics, you need at least 20 billion units of probiotics every day. reduce all of this good stuff. The tobacco that so many people still smoke. It amazes me that people still do this, but they still do, and it's very addicting, but they still smoke. Alcohol, in moderation. Drugs, you should get rid of all of those. Allergic and pro-inflammatory foods, I talked about. You need to get about 7 to 8 hours of sleep. And for kids, formula is not better than breast milk. So I encourage all my moms to make sure they're breastfeeding. It really prevents them from developing leaky gut at a very young age. And then when you go to the doctor and you know you have a cold, don't ask for an antibiotic. When you take an antibiotic, what does it do to your body? Does anybody know? It's killing bacteria, right? Does it know the good bacteria from the bad bacteria? And when you have a virus, is an antibiotic going to help a virus? No, viruses don't kill, antibiotics don't kill viruses. They kill bacteria. So if you have a cold, which is most likely from a rhinovirus or a Coxsackie virus or some other virus, taking an antibiotic does not help. All it's doing is killing out all your good flora in your gut and causing the bad bacteria, the resistant bacteria, to overgrow and to cause leaky gut. So you have to have good antibiotic stewardship. And there's patients who come in, they're like, Doc, I don't really need an antibiotic. You know, I just wanted to make sure I didn't have a bacterial infection. And once I can tell them that, then they go home and they take more natural nutrition. They'll allow the body to kick it out. Some vitamin C and some Natronex or something like that. Anti-inflammatories. Every time you get an ache and pain, you're popping an Advil or a Motrin, and you're creating problems. You don't need it. It's going to create inflammation in your gut. And then the proton pump inhibitors I mentioned before, Nexium and stuff like that. All right, so diet. You see all this good stuff this is not, you pick this stuff from a tree or it comes from a vine. It's not coming out of a plastic or a box. This is how God intended you to eat. Natural foods. So you do this, and you chase the animal, you grab them, fresh meat, you know, chicken, and fish, and you catch it, and you know, you manage your stress. So this is important. It's not just what you eat, but how. You want to eat smaller meals, and I recommend at least 5 meals, ideally 6 meals a day. This way you don't get big spikes of your blood sugar level and spikes of the insulin, which creates you to hold on to fat. So 5 to 6 meals per day is what's physiologically better for you. Everybody always tells me, I have a lot of professional people, 5 meals a day. First of all, when you look at most people who are overweight, they miss breakfast. So right around 10, 11 o'clock, they get hungry. Now they've gone out on an empty tank. So the body says, instead of burning calories that whole time, it shuts down because it senses starvation. There's no food. Meanwhile, you have all this excess adipose tissue or fat tissue on your body that it's not burning. So you have to jumpstart the body. You have to eat a breakfast. And breakfast should be a whole grain of some kind. I recommend oatmeal. It's good. Eggs are good in the morning. You don't want to do the bread. You don't want to do that. But the eggs, you can have bacon, turkey bacon. You can have meat. You can have a piece of chicken breast in the morning. That's good to mix the protein with the carb in the morning to get you jump started. Then by 10 o'clock, you should be eating again. 10, 11 o'clock. And then you're eating again at 1 o'clock. And then you're eating at 4 o'clock. And then your last meal somewhere around 7 o'clock. That's what you're supposed to do. That's what is physiologically better for you. And you'll never gain weight doing that. And you're not going to eat king's portions. You're eating pauper portions. Okay? So you're eating small meals each time just to keep you there like you're grazing. You know, and you're just keeping your blood sugar at a nice level. And so metabolism constantly working. It's like working. And you just keep the weight off that way. Okay, so take time to sit and eat your meal. It's not a rush. We do it all the time. You know, and I learned how to eat badly in residency because I was always, when I was on call and I was covering the nursery, the neonatal ICU, you know, you sit down and within like 3 minutes I could gobble down a full meal because I'm afraid the beeper is going to go off and then I'm going to have to run and not get anything to eat, so I might as well get it in. And it's been hard for me to break that habit because I still eat pretty fast. But now at least I can get at least 4, 5, 6 meals in per day, and that's helped. So take your time, relax, enjoy your life, eat slower. My wife is sitting there, she's saying, "You're right. I still eat too fast." So complex natural carbs is important. Organic foods, this is what you're looking at. These are all complex natural carbs. And then lean proteins. Don't eat the fat of an animal. The fat has all the toxins. That's where it's stored. So cut it off, lean it. Don't even eat the skin. Don't eat that. Eat the lean piece of the meat. Avoid white flour, white bread, and white rice. Tell me why. I've said it.
Full carbs. It turns into sugar immediately.
Right. Did anybody get that? All right? Okay. Cut out sweets, baked goods, and sodas, and processed foods, and salty foods. This is going to help you. So, detoxification. Now, say you did everything wrong, and now you're filled with toxins, and you're tired all the time, you're having pain. How do you heal yourself? The process is called detoxification. You're going to remove all these toxic substances out of your body and heal yourself. The liver is the primary organ responsible for detoxification because everything that's absorbed from the gut must pass through the liver. Think of the physiology, think of the anatomy. It must go through the liver. So the liver gets clogged up. It's like the first line. It gets clogged up with all that toxins and it gets congested. So you got to flush it out. I was talking to a young lady today who told me that her 12-year-old daughter came down with lupus. And she developed lupus kidney disease, ended up on dialysis. She went to see a holistic doctor because her husband is into holistic integrative medicine. And the doctor, they had her on steroids, she was blowing up, she was getting dialysis, and she was just not doing any better. He put her on a detoxification program, detoxing her liver, detoxing her kidneys. And in several weeks, 8 weeks, she was off dialysis, and her whole level, they got rid of it. She had gotten a lot of immunizations, and her diet was pretty poor with processed foods. Once she got detoxed, all those antibodies that develop in lupus left her body, the antigens left her body, and she was cured. And she's now 19, and she's never required dialysis again, and she's living her life. She's in college, a sophomore in college. Just telling you. You know, we could, and I can tell you as an allopathic physician, because I'm an MD, I'm not an ND, I'm an MD, a medical doctor, they would have just continued, and you know, they did exactly what they did. They did not go to the allopathic doctor, but they were doing the cleansing on the side, the detoxification on the side. And so eventually they're like, wow, you don't need this anymore. No more dialysis, and she was doing fine. So think of what the functional aspect to healthcare is, looking at what happened to that patient, letting the body heal itself through nutrition, detoxifying the body. So anyway, the liver gets overwhelmed with all these toxins that are coming through the GI tracts all the time. So you definitely need to detoxify. This is the whole process, 1, 2, 3, and 4. This is what you need to do to eliminate, to remove all the toxins. We have a product that we use here. It's called Core Restore. It's a detoxification powder. You want to eliminate all those foods that I told you about. And it's a 7-day detox. That's what gets you started. You want to remove all the bad bacteria that's in there. So sometimes we do a stool analysis to check to see, do you have Clostridium there? Do you have any other bad bacteria, Salmonella, Shigella? Do you have that there? Do you have an overgrowth of yeast, Candida, which is causing a problem? These things have to be checked for. Then you want to treat those and get rid of them. Then you want to replace, you want to take digestive enzyme to help you break down your food, because then, you know, the pancreas is probably overworked when you're toxic, so you want to give it some help. What happens as you age? What happens to the acid in your stomach as you age? Does it go up or goes down? Can you tell me that? You think acid go up? It goes down. So why are we using all these acid blockers? Why do we use acid blockers? To treat acid reflux. Acid blockers, reflux is not from excess acid. It's from dysbiosis, it's from obesity. You don't need acid blockers. All you're doing is creating more problems by blocking the acid. You need the acid for digestion, and you need the acid to kill pathogenic organism from getting down from the mouth into the stomach. So no. So you want to use hydrochloric acid, you want to use vegetable enzyme, and then you want to use probiotics, beneficial bacteria in the gut, and then lastly you want to use a anti-inflammatory for the gut, which is glutamine and some other bowel nutrients to get your gut integrity back in order. So 1, remove, 2, replace, 3, put the good bacteria back in, and 4, to repair. A 4-step process. This is what happens when you detoxify the liver. You have phase 1 and phase 2. You use a lot of B vitamins. You need your vitamins. And then you need all of these good components here, amino acids and B vitamins, to get through phase 2. 2 phases of liver detoxification. Stress is a horrible thing. We all experience it. It's really how you handle it. Stress management is very, very important. I talked about meditation, praying, I talked about yoga. Take time for yourself, relax, do some hobbies. Very important. You can't just work all the time. It's not good. Role of digestive enzyme I talked about. Role of probiotics I talked about. Why you need to take it. These other nutrients here, omega-3, turmeric is a great anti-inflammatory for the gut. Green tea, garlic, ginger, alpha-lipoic acid, N-acetyl D-glucosamine, all the B vitamins, all the berries, quercetin, all very good for you. And then glutamine. It heals the gut. It's a wonderful amino acid that heals the gut and makes your gut integrity back to where it's supposed to be. Now the U.S. Preventive Task Force recommend a colonoscopy at the age of 50 all the way up to 75, and you're supposed to get one. If it's negative, you get one every 10 years. If you have a strong family history, you can get one as early as 40 to 45. I recommend screening, but if you're eating right and you keep these toxins out, greater likelihood you're not going to get colon cancer, the 3rd most common cancer in the United States. People with ulcerative colitis, inflammatory bowel disease, celiac disease are all at risk for colon cancer. And obviously if you have a family history. They don't recommend it that much. They don't recommend against it if you're up to 85, from 76 to 85. And if you're over 85, they figure you're old enough, you don't need to be screened. Right? So, but from 50 to 75, definitely get screened. Over that, the government ain't going to pay for it. You can still get it, but you're going to have to pay for it yourself. So this is the protocol. You do the core restore for 7 to 28 days. You eliminate the pro-inflammatory food. You take probiotics every day. You use your veggie enzymes to restore your function. And you use your gut extinguisher, which has the glutamine and the N-acetyl glucosamine in there to help you to purify your gut. All right? So that is my talk. I'm just going to go over what's in the core. These are the detoxification units. I do have a raffle for one of these detoxification kits. So whose ever name I pull, actually Jackie will pull it, will get a free kit. Then I also have a raffle for the gut extinguisher. This has the glutamine in it. So, and then we have a few of them for sale as well, so if you don't win, please buy. For this presentation, there's a 10% off on the cost of these things. So let me tell you what's in it, and then I'll do the raffle. it's important that everybody knows how to get detoxified. Everyone needs it. Everybody here needs to be detoxed. Some of us have already had detox. This is the detoxification powder. You drink this twice a day. It may taste a little chalky, but you know what? It's doing its job. If it doesn't take chalky, then it's probably not doing its job, no. Use rice milk or almond milk. Don't use cow's milk. Not good, not good. I don't, dairy's out of this. When you're doing your elimination, you're detoxifying, no dairy, no wheat. All right, very important. No soy either, because soy is also genetically modified. That's why you hear me, I didn't mention anything about soy. Soy in this country is not good. It's genetically modified. You can get soy to China, maybe it's a little bit different. All right, so you want to drink this powder twice a day. Then, remember I talked about phase 1 detoxification. These are all the nutrients you need to assist the liver to declog itself. Oh, it is? Oh. Alpha base. This all comes in the kit. It all comes in the kit. So you take this pill every time you drink the shake, so twice a day. So it's helping. And then last, after the first 2 days, you do the Fighter Core. These are all plant-based anti-inflammatories that's going to reduce the inflammation in the gut. You guys have heard of turmeric, correct? Yeah. You got good vision, man? Can you read that for me? I'm over 50, so obviously I got my colonoscopy too, so I'm good. Anyway, it comes with this too. This is a portable blender, so you can, if you're on the go and you want to blend, it comes. Every kid has one of these. I have about 100 of these in my house because I have a blender. But they come in the kit, so it's something that, now this book comes in it, and it tells you what's in the Fighter Core.
We got dandelion.
Dandelion.
Extract. Choline what? Yeah, not good breakfast. Bilatrate, artichoke leaf extract.
Artichoke, okay.
Inositol.
Inositol.
Yeah, milk thistle seed extract.
Milk thistle. That's a good liver detox.
Garlic.
Garlic.
Turmeric root extract.
Turmeric, right.
Beet leaf.
Right. So you take all of these from day 3, you do that twice a day with the powder, so it's a 7-day detox. And usually most people lose between 5 and 10 pounds of waste, and they feel energized. If you have an autoimmune condition like lupus or thyroid condition, you need to do this for at least 2 to 4 weeks. If you don't have any condition, just for overall health, then I recommend it just for a week. And you should do that repeated every 6 months to kind of just like help your body and stay away from those foods. But this book will tell you exactly why you need to detox, pretty much what I've discussed today. And it talks about all the what foods you can eat while you're on the detox, what foods you should not eat. Let me just go over the ones that you shouldn't eat real quick. Refined foods, I talked about wheat, if it's refined. Peanuts is not good, because that's also genetically modified. Soy nuts, milk, cheese, eggs, yogurt, you should not eat it, because it's all dairy-based products. Margarine, horrible. Can't do that. Mayonnaise. And the thing that gets a lot of people, and gets me, is coffee. Because caffeine, you can't detoxify when you're on caffeine. So it's usually, first couple of days you may get a little bit of coffee-free headache, but if you drink enough water, it'll go away and you won't need to take any medicine for that. But eggs is out of it, fish and shellfish is out of it, fried foods you can't do, but you can eat a lot of other good stuff. You want to drink a lot of water and vegetable juices, herbal teas, green tea. Lots of spices. Almond is a great nut. You can have almond, you can have cashews, you can have walnuts, you can have rice, whole grain rice, you can have buckwheat, millet, quinoa, you can have all of that, broccoli and all the good cruciferous vegetables. So the book comes in it, it tells you everything you need to know to detoxify yourself. is here. And who's going to pull the raffle? First for the detox. Let me, Miss Beard, you may pull your own ticket, but we'll keep it.
Catherine did, no, I'm just kidding. Martha Sweeney.
Martha Sweeney. All right, Martha.